I am Dr. Leana. Welcome to our channel. And something could be happening inside your colon right now that does not feel like a colon problem at all. Not pain. Not dramatic bleeding. Maybe just tiredness, weakness, or a bathroom change you keep blaming on age. Today, you'll learn 6 warning signs adults miss too long, why they happen inside the body, and the hidden final sign that can appear before obvious symptoms ever show up. Please keep watching closely, because here is the uncomfortable truth. The colon is one of the easiest organs to ignore until it starts interfering with daily life. You do not see it working. You do not feel every movement it makes. And when symptoms begin, they often look ordinary. A little constipation, a little bloating, a little blood that someone assumes is hemorrhoids, a little fatigue that gets blamed on being over 50. But here's the shocking part. Colon problems, including polyps and colorectal cancer, may develop quietly. The CDC warns that a person can have polyps or colorectal cancer and not know it, which is why regular screening matters so much. And wait for it, because this is where many people make the first mistake. They look for one dramatic symptom. They imagine severe pain, obvious bleeding, or a sudden emergency. But the colon often whispers before it shouts. It sends patterns. It sends changes. It sends signals that are easy to explain away if you are busy, embarrassed, afraid, or convinced that every digestive change after 50 is just normal aging. The truth is, aging can change digestion. Medications can slow the bowel. Lower activity can increase constipation. Diet changes can affect stool. Hemorrhoids can bleed. Stress can disturb the gut. But aging should never become a hiding place for new, persistent, unexplained symptoms. That word matters. Persistent. One strange bowel movement after a heavy meal is usually not the concern. One day of constipation after travel is common. Temporary diarrhea after a stomach bug happens. But when a new pattern stays, returns, worsens, or comes with blood, weakness, weight loss, pain, or anemia, your body may be asking for help. And by the end of this video, you will know the 6 signs, the 3 mistakes people make when they notice them, and the 1 hidden symptom that may show up in your blood before you ever see anything in the toilet. The first warning sign is a change in bowel habits that does not go away. This can mean new constipation, new diarrhea, going more often than usual, going much less often, or feeling like your bathroom routine has shifted for no clear reason. Most people immediately blame food. And sometimes food is the reason. More dairy, less fiber, dehydration, antibiotics, travel, stress, or eating at strange times can all change the bowel. But if the change is new and persistent, pay attention. Your colon is not just a waste pipe. It is a living, muscular, nerve-rich tube. It absorbs water, moves stool forward, communicates with your immune system, and responds to gut bacteria, hormones, inflammation, blood flow, medications, and aging. Think of your colon like a coordinated traffic system. When everything is working well, stool moves forward in a predictable rhythm. But if the lining becomes irritated, if water absorption changes, if the muscles slow down, or if part of the passage becomes narrowed, the traffic pattern changes. Things may speed up. Things may slow down. Things may become unpredictable. But here is the shocking part. Many adults tolerate this for months because they say, "I have always had a sensitive stomach," or "I am just getting older." But an old pattern is different from a new pattern. If you have been constipated most of your life, that is your baseline. But if you suddenly become constipated when you never were before, that is a change. If you suddenly have looser stools for weeks, that is a change. If you suddenly need the bathroom at a new time every day, that is a change. And after 50, new patterns deserve more respect. So ask yourself this: has my bowel rhythm changed in a way that is unusual for me? Has it lasted more than a few days? Is it returning again and again? Is it happening with pain, blood, weakness, or unexplained weight loss? If the answer is yes, do not panic. But do not dismiss it. The second warning sign is blood in the stool, blood on the toilet paper, or stool that becomes dark and unusual. This is one of the most commonly dismissed signs because people often assume it must be hemorrhoids. And yes, hemorrhoids can cause bright red blood. So can small tears, irritation, constipation, and other non-cancer causes. But here is the mistake. Assuming blood is not something to casually explain away, especially if it is new, repeated, increasing, or combined with other symptoms. Bright red blood may come from the lower rectum or anus. Darker blood, maroon stool, or black tarry stool may suggest bleeding from higher up in the digestive tract. And sometimes bleeding is not visible at all. That is the part most people do not think about. A person may be bleeding slowly inside the colon without seeing red in the toilet. A tiny amount of blood may be lost again and again. Not enough to create panic. Not enough to look dramatic. But enough for the body to start losing iron over time. Remember that, because it connects directly to the final warning sign. Inside the colon, abnormal or irritated tissue can be fragile. As stool passes over it, that tissue may bleed. Sometimes lightly, sometimes intermittently, sometimes so subtly that the only clue appears later through fatigue or abnormal blood work. You won't believe how often people delay care because they are embarrassed. They notice blood once, then twice. Then they start checking less, not more, because they are afraid of what they might see. But fear does not protect you. Information does. The American Cancer Society lists rectal bleeding, blood in the stool, dark stool, bowel changes, abdominal pain, fatigue, and weight loss as possible symptoms of colorectal cancer. But those symptoms can also come from other conditions, which is exactly why evaluation matters. The goal is not to diagnose yourself in the bathroom. The goal is to stop guessing. If you notice blood, especially if it repeats or appears with other changes, speak with a qualified healthcare professional. Do not decide on your own that it is just hemorrhoids unless it has truly been evaluated. The third warning sign is the feeling that your bowel does not empty completely. This one is subtle. A person goes to the bathroom, but afterwards something feels unfinished. They may return to the toilet again and again. They may strain. They may feel pressure in the rectum. Or they may notice that stools look thinner or narrower than before. Now, let's be careful. A narrow stool once in a while can happen with constipation, dehydration, muscle tension, or diet. That alone does not mean cancer. But if stool shape changes persistently, or if it comes with urgency, rectal pressure, bleeding, pain, or the feeling that you cannot fully empty, it deserves attention. Here is why. Your colon and rectum have stretch receptors. These are tiny sensors that help tell the brain when stool is present and when the bowel has emptied. If the rectal area is irritated, inflamed, narrowed, or occupied by abnormal tissue, those signals can become confused. The brain may receive a message that says, "Something is still there," even after you have gone. That creates a frustrating loop. You sit longer. You strain harder. You go back again. You wonder if you need more fiber, more laxatives, or some kind of cleanse. But here is the truth. Your colon does not need punishment. It needs interpretation. A cleanse may make you feel like you are taking control, but it can also distract you from the real question. Why did this new sensation begin in the first place? And this is where older adults can get trapped. They blame the symptom on constipation, then treat the constipation, but never ask why the constipation or pressure suddenly changed. So listen closely. If your body keeps sending the same unfinished signal, especially when it is new, repeated, or combined with other warning signs, do not ignore it. It may be harmless. It may be treatable, but it should not be endlessly explained away. The fourth warning sign is ongoing abdominal discomfort, cramping, bloating, gas, or pressure. This is probably the easiest symptom to normalize. People say everyone gets gas, and they are right. Your colon is filled with bacteria that help break down food. That process naturally produces gas. The colon also stretches, contracts, absorbs water, and moves material throughout the day. So occasional bloating or cramps can happen for many reasons. But persistent discomfort is different. When discomfort keeps returning, becomes more frequent, wakes you up, appears with bowel changes, or feels different from your usual digestion, the stakes change. Here is what may be happening inside. If stool is moving too slowly, gas can build behind it. If part of the bowel is narrowed, pressure can increase upstream, like water building behind a kink in a hose. If the lining is inflamed, the nerves become more sensitive. Normal stretching may feel painful. Normal gas may feel like pressure. Normal movement may feel like cramping. And now we need to talk about inflammation. Inflammation is not always bad. Acute inflammation is part of healing. If you cut your skin, your immune system rushes in like a repair crew. It sends chemical signals, clears damage, and starts rebuilding. That is useful. The concern is persistent, low-grade inflammation, the kind that keeps the immune alarm switched on. Over time, chronic inflammatory signaling may irritate tissues, affect the gut barrier, disrupt the microbiome, and place cells under more stress. The microbiome means the community of bacteria and other organisms living in your gut. Some help you digest food, train your immune system, and protect the lining of the colon. But when the gut environment becomes disturbed, the whole system can become more reactive. And here is the pattern interrupt. Not every bloated day is dangerous, but every repeated pattern deserves curiosity. If your bloating is new, if your cramping is persistent, if your abdominal discomfort is different from your normal, or if it comes with blood, bowel changes, fatigue, or weight loss, it is time to stop saying, "It is just digestion," because the colon does not always send one clean message. Sometimes it sends a cluster, a little pressure, a little irregularity, a little bleeding, a little exhaustion. Each one may seem small alone. Together they may tell a very different story. The fifth warning sign is unexplained weight loss or a change in appetite. This one is emotionally complicated because many adults over 50 are taught to celebrate weight loss automatically. The scale drops and they think, "Good, I needed that." But intentional weight loss and unintentional weight loss are not the same. If you changed your diet, improved your sleep, increased your walking, lifted weights, reduced processed foods, and gradually lost weight, that makes sense. But if weight drops without trying, especially with bowel changes, fatigue, pain, or appetite loss, the body may be under stress. And you won't believe how quietly this can happen. Some people do not lose a dramatic amount overnight. They just notice their clothes are looser. They get full faster. They skip meals because food does not sound good. They say, "I'm just not as hungry anymore." But here's the shocking part. After 50 and 60, unexplained weight loss can mean loss of reserve. Muscle is not just for looking strong. Muscle helps control blood sugar. It supports balance. It protects bones. It gives the body strength during illness. It acts like a metabolic savings account. When the body loses weight without a clear reason, especially if it is losing muscle, that savings account can shrink. The mechanism may involve several systems at once. Chronic disease and inflammation can change appetite signals in the brain. Inflammatory chemicals can make food less appealing. They can alter metabolism, meaning the body may use energy differently. A growing problem in the colon may also affect comfort after eating, digestion, fullness, or bowel movement patterns. So here is the question. Are you losing weight because you changed your habits? Or are you losing weight because your body changed the rules without asking you? That question matters. If your appetite changes without explanation or your weight drops without effort, do not simply accept it as aging. Do not automatically celebrate it. Track it. Mention it. Ask your healthcare professional what might be causing it. Because sometimes the body does not whisper through pain. Sometimes it whispers through the scale. And now we come to the sixth warning sign, the one many people miss because it does not feel like the colon. Fatigue, weakness, shortness of breath, dizziness, brain fog, or iron deficiency anemia. This is the quiet warning. A person may not have severe belly pain. They may not see blood. Their bowel movements may be only slightly different, but they feel drained. They say, "I must be getting older. I just do not have the energy I used to. I get winded on stairs. My legs feel heavy. My mind feels foggy." Then a routine blood test shows low iron or anemia, and suddenly the question becomes, where is the blood going? To understand this, think of red blood cells as delivery trucks. Their job is to carry oxygen from the lungs to the brain, heart, muscles, and every working tissue in the body. Iron is a key part of hemoglobin, the oxygen-carrying protein inside those red blood cells. Without enough iron, the body cannot make enough strong delivery trucks. Oxygen delivery drops. Muscles feel weak. The brain feels foggy. The heart may beat faster to compensate. Climbing stairs may feel harder than it should. Now imagine a small amount of hidden bleeding in the colon. Not enough to turn the toilet red. Not enough to scare you. Just slow, repeated blood loss. Day after day, the body loses iron. At first, it may compensate. Then the reserves fall. Then fatigue appears. And this is why anemia after 50 deserves a real explanation, especially in men and in women who are no longer menstruating. The colon may be bleeding silently. Remember when I mentioned that blood can be invisible? This is where that detail becomes important. A person can look in the toilet and see nothing alarming, while their blood work quietly tells the truth. That is why fatigue plus bowel changes, fatigue plus dark stool, fatigue plus unexplained weight loss, or fatigue plus low iron should never be ignored. This is the most important point of the entire video. Colon warning signs are not always located where you expect them. Sometimes the colon speaks through the bathroom. Sometimes it speaks through the blood. Sometimes it speaks through energy. And if you only look for pain, you may miss the signal. Now, before fear takes over, let's be clear. These symptoms do not automatically mean colon cancer. Many conditions can cause them, including hemorrhoids, diverticular disease, infections, inflammatory bowel disease, irritable bowel syndrome, medication side effects, ulcers, thyroid problems, dietary changes, and other medical issues. But the goal is not to diagnose yourself. The goal is to stop dismissing patterns that deserve evaluation. Colorectal cancer is one of the more common cancers in the United States, and SEER data estimate that about 3.9% of men and women will be diagnosed with it at some point during their lifetime. That number is not meant to scare you. It is meant to remind you that screening and early attention are not optional details. They are protection. The CDC says adults age 45 to 75 should be screened for colorectal cancer, and decisions from 76 to 85 should be individualized with a healthcare professional. People at higher risk may need to start earlier or follow a different schedule. And here are the 3 mistakes I promised you. Mistake number 1 is waiting for severe pain. Mistake number 2 is assuming blood is always hemorrhoids. Mistake number 3 is treating fatigue as normal aging, without asking whether blood loss, anemia, or another medical cause is involved. Food and lifestyle do matter. Fiber, enough water, regular movement, healthy body weight, limiting processed meats, avoiding smoking, and following screening recommendations may support better colon health. But fiber does not replace screening. Water does not explain away bleeding. A probiotic does not solve unexplained anemia. And a cleanse should never be used to avoid medical evaluation. So let's recap the 6 warning signs. Number 1, a persistent change in bowel habits. Number 2, blood in the stool, on the toilet paper, or stool that becomes dark and unusual. Number 3, the feeling that your bowel does not empty completely, especially with pressure, urgency, or narrow stools. Number 4, ongoing cramps, bloating, gas, or abdominal discomfort that does not fit your normal pattern. Number 5, unexplained weight loss or appetite change. And number 6, the hidden one, fatigue, weakness, shortness of breath, dizziness, brain fog, or iron deficiency anemia. Your colon does not need you to panic. It needs you to notice. If any of these signs are new, persistent, worsening, or combined, please speak with a qualified healthcare professional and ask directly whether your colon needs evaluation. I am Dr. Leana, and if this helped you see colon symptoms differently, share it with someone over 50 who keeps saying, it's probably nothing. And tell me in the comments, which warning sign surprised you the most? The blood you may not see, the weight loss people celebrate, or the fatigue that may not feel like a colon symptom at all? Like this video, subscribe, and stay close to your body's signals. Because sometimes the symptom you almost ignore is the one that finally gets you checked in time.